Issues involving health, education, and external pressures are negatively affecting our younger generations. My name is Anya Parasher. I'm a high school student and an advocate for mental health. Join me as I explore and learn about these issues and their possible solutions with various experts and leaders around the country. This podcast is affiliated with Project ECHO, Extension for Community Health Outcomes, a worldwide nonprofit organization that spreads critical and life-saving knowledge to various communities across the globe. Welcome and thank you for joining us. Welcome to the second segment of the LIFTER podcast. Joining us today is Dr. Sanjeev Arora. As founder and director of Project ECHO, he has dedicated his life to creating change within our community. In today's episode, we talk about Project ECHO, the ECHO model, how to create change within a community, and the issues that youth face not only in Albuquerque, but throughout the world. Thank you for joining us. I want to start off by talking about how Project ECHO came to be. When did you first come up with the idea and how did you go about executing it?
So one of the problems that I was facing in New Mexico, I'm a gastroenterologist, I work here at the university, is that there were 28,000 patients with hepatitis C in New Mexico, and only 1,500 had been treated. As a result, the other people didn't have access to treatment because there weren't any gastroenterologists in rural areas or other people who had the expertise to treat this disease. I specifically remember a patient that I saw in 2001. She was a 43-year-old woman, and she came to my hepatitis C clinic, and I asked her, "How can I help you?" And she said, I have hepatitis C and I want treatment. And I said, "How long have you had it?" She said, "I've had it for 8 years." So I said, "Why did you not come earlier for treatment?" And she said, "I'm a single mother. I live 200 miles away. And I'd called your nurse and there was an 8-month wait to see you. And I would have to drive 200 miles each way 12 times to get this treatment while taking this chemotherapy-like regimen. And so I decided not to take the treatment because I couldn't afford to do all this travel and take so much time off work." So I asked her, "Why did you come today? What changed for you?" She said, "I'm having pain here in the right side of my abdomen." And I did an ultrasound of her liver, and she had a cancer of her liver, which was sort of halfway between a golf ball and a tennis ball. And it was too large for us now to cure her with a resection of the liver or a liver transplant. And she passed away 6 months later, leaving these 2 children. And I was asking myself, why did she die of a disease that I knew how to treat? That was, we are living in the United States, all the medicines were available. But she died because the right knowledge didn't exist at the right place at the right time. And that can be fatal. I later realized in the course of doing ECHO all over the world that almost 6 billion people in the world don't have access to the right knowledge at the right place at the right time. That is almost 3/4 of the world. That's the problem. They're living in rural areas. They're living in Africa. They're living in rural India or Pakistan. And there isn't really that availability of the right knowledge where they live, and they don't have the ability to get there. And millions die unnecessarily. For example, 1,800 children die every single day of diarrheal diseases. And the treatment is pretty straightforward, oral rehydration and some simple antibiotics, but you can't get them if you don't know what's going on. So this is the challenge that I was trying to meet, and I created ECHO to democratize the expertise that I had, to democratize its implementation so that anybody could get care close to their home where they lived.
And, to go on from that, ECHO programs use the ECHO model of all teach, all learn through case-based learning. So could you walk through that model and the advantages that it has?
Yeah, so going back to starting the hepatitis C, I wanted to treat 28,000 patients and I had to multiply myself. I had to decide how to do that. So I developed the model for that purpose. We call this idea force multiplication. How do we exponentially improve the capacity to deliver best practice care? Not doubling it 10 times.
Mm-hmm.
So the first principle was we could use technology like we are using now. And I was using FaceTime at that time with my daughters. And I was saying, so we developed a one-to-many video conferencing since Zoom was not born at that time.
Yeah.
And we created our own solution. And I said I would find some mentees in rural areas. So that's the first principle, to use technology to leverage expertise. The second key idea in Project Echo was to sharing best practices. So I went around the state of New Mexico and set up 21 new treatment sites in rural areas, 16 in rural areas, 5 in prisons. And I gave them my protocol for treating hepatitis C, but they said, no, this is chemotherapy. We can't do this. This is too dangerous. So that brought me to the third principle. I asked myself, how did you become an expert in treating hepatitis C? So when I did my fellowship in Boston, I would see a patient, present to my professor, see another one, present to my professor. And after 2 years, they said, you're a gastroenterologist. I said, aha, I'm going to use this model to create new hepatitis C specialists in New Mexico without them having to do fellowship programs through this iterative guided practice. All teach, all learn. And the fourth principle was to track outcomes. And the all teach, all learn was critical, Anya, because a specialist doesn't really have access to the full best practice. The specialist has the specialist knowledge, but it is the rural doctor who understands the culture, the economic constraints, the cultural norms of those people, the religious constraints. There is so much to best practice. But when you bring these together, the second idea was that any one person did not have enough patients of hepatitis C to become an expert themselves. After
Mm-hmm.
all, a rural clinic was not a hepatitis C clinic. But this way, when they joined once a week in an echo network, they would join every Wednesday afternoon and present cases to each other. So we would discuss about 8 patients. So this way, each of the 21 clinicians could learn from each other, not just from their own cases. They could learn from experts, but mostly they learned by doing. And this learning by doing is synonymous with like trying to teach your daughter to drive a car. You couldn't just give her lectures on driving a car, because if the problem has a characteristic which we call dynamic complexity, that is changing all the time, and it's complex, then you need guided practice.
Yeah.
And that's what Echo is about.
That's awesome. And um, I just wonder, were there any challenges that came along the way of building Project Echo?
One of the biggest challenges we had ever since we started Project Echo was that so much of our healthcare system is geared towards optimizing financial outcomes.
Mm-hmm.
How does the hospital make money out of it? How does a doctor make money? Whereas this was much more of a social service project where I was democratizing my project, my knowledge, my expertise. I was making other people as good as me. And there was never a reimbursement mechanism for that to cover my time, to cover the time of my team. And so the fee for service model that exists in the United States inherently doesn't have any resource allocation for this kind of mentoring, training, and development. And that has been a constant challenge. But the interesting thing that we found, Anya, was there were a lot of people in the world whose primary motive was not money, that they were driven, what they basically were in a different place like me. I said, look, I have gained so much expertise all my life. And when I retire, it'll all go away.
Mm-hmm.
And I want to help a lot more people, because otherwise I could only help those people I saw myself in my clinic, right?
Yeah.
But what could I do? I wanted to help 1,000 times more patients. And so Echo gave me that way of doing that. And that's why Echo has grown globally and is now in 193 countries, is because so many people have found that serving others is a way to bring great joy to yourself and to live a fulfilled life. And but the challenge of financing Echo still remains.
Yeah. And I think to add to that, I started working at Echo last June, around June. And one of the things that I immediately noticed is how passionate everyone, any staff member who works for Echo is. And to add on to the global aspect of Project Echo started out by meeting the needs of people across New Mexico, but it's now become this huge global organization. So how did that come to be? And did you ever really expect Echo to become this big?
I never really expected it to become as big as it is now. I was just putting one step in front of the other. I knew intuitively that Echo had the potential to change the world, but the question was still uncertain. Would it do it?
Yeah.
So the first step was we started using it for a lot of different disease areas in New Mexico. So we had my hepatitis C on Wednesday, and Monday diabetes, and Tuesday HIV, etc. And then the challenge was there were only 2 million people in New Mexico when 6 billion people didn't have the wherewithal to get this treatment or any treatment which was best practice. And how do we reach them? And this is where a critical decision had to be made. Would I sell Echo to everybody else because now I had the technology? But I think at that point, I made a crucial decision that I would completely fire my wall myself from any financial outcome of Echo, that I would keep creating intellectual property and give it away, just like I was requesting specialists to democratize their expertise. I would democratize the expertise of doing Echo. I would give away, at this point, I got a worldwide Zoom license. I was able to give away thousands of them. And I developed an iEcho platform. And I said I would give away everything and give away 3 days of training to any university or not for profit in the United States or the world. I would give them Echo for free. And we would spend our time to train them to do it. And once we started doing that, I was surprised that all the major universities, from Harvard to Stanford to Johns Hopkins and MD Anderson in Texas, they all adopted Echo. We now have 401 hubs in the US, and globally we have 966 hubs. And we've had 4.1 million learners in 193 countries. And the actual number of countries in the world is 195, with only 193 UN members. The other two are what they call observer states in the UN, which is called the Holy See, and the other is the state of Palestine. So we are basically in every country in the world now, and it spread because of the fact that Echo is a sharing model. We didn't put this money thing in between saying, I will give you this if you give me this. I think that transaction has got a very, very problematic characteristic to it.
Mm-hmm.
The one thing about it is it can scale quickly. So Coca-Cola is an example of that, right?
Yeah.
I'll give you this Coke if you give me 5 cents, right? It scales. And everybody who sets up a Coke shop can make money. But the problem with most of these models which are associated with money is that low-income people get deprived because they don't have money. That's essential ingredient for their economy to work. Whereas in Echo, it's much more works on love and respect and kindness and community and empathy. And I think that is also a force that is extraordinarily powerful in the world. In fact, it's more powerful than the financial force if applied correctly. The other reason why echo works, Anya, is that the physics of knowledge is very different from the physics of money. That if I give you half my money today, guess how much I'm left with? I'm left with half. But if I give you my knowledge and you give me yours, and I listen and I give you the respect, so I listen to you carefully and understand what you're saying and assimilate your perspectives into mine, then we both become richer.
Yeah.
So knowledge grows. It's like love, it's like joy with sharing. So it is a potential way to make the world better. Because one of the greatest challenges in the world, which cause a lot of wars, famines, terrorism, border disputes, is inequity.
Hmm.
If I don't have any food in my house, and I'm surrounded by houses which have abundance, my desire to steal is almost unstoppable. Because whereas, but there's also not enough money to make everyone rich.
Hmm.
But there is enough knowledge that if we share it freely and learn from people in Sudan and Africa and Rwanda and Zambia, and we also can become richer. We expand our horizons and the world becomes better. Everybody becomes richer.
Yeah. I love that metaphor you used about knowledge. It's like it's not a transaction, but everybody gains from it.
Uh,
And I want to add to that previous question that not only did it start off small and grow big, but in terms of which sectors Echo works in, it started out in medicine and health, but it's now expanded into other areas like education and civics. So, what's the next big focus for Project Echo?
one of the things, as I've worked in health all my life, right? And
Hmm.
I've found that the biggest predictor of the health of an individual is actually their educational status. Because an education allows them to understand, to take care of themselves, and also results in economic output for their family. They can buy the right food, and so on and so forth. They can get treatments for disease. So, really, the purpose for starting Echo is equity. And in my view, there is no better way in the world to produce equity than to take education to people who don't have good access to it. So imagine a student born in South Sudan, living in a village. They don't have a teacher who can explain the concepts of math and science. They don't have a teacher who knows the latest technologies on how to build literacy, the letters program, or whatever. This child may have all the intelligence that has been given by nature. They cannot achieve their true potential easily. But changing the outcome, the educational outcome of that child by mentoring school teachers in that village to provide this opportunity to that child can be a game changer for the world, basically. That's really going to be a big focus of mine. And how do I ensure that every child in the world can have a good education, even if they don't have a teacher there? Can there be a lay person, somebody working in a business there who's willing to be trained with the latest technologies on teaching, the latest methodologies, the evidence-based methods? So that is the number one opportunity to make a difference. Now, I'm a physician, so I don't claim to have that expertise, but I'm looking for people in the world who are willing to take on this mission and run with it and change the world in that direction.
And you talked about the emphasis on youth and and educating children. This podcast focuses specifically on youth issues. So, what's Project Echo's role in serving the younger populations throughout the world?
I think one is, of course, the education echoes, but one of the challenges that we have in the world, which is huge, is that children don't have access to good mental health care. Even in the United States, living in New Mexico, the average child cannot get good mental health care in rural New Mexico. Even in Albuquerque, the wait to see a child psychiatrist is many, many months. We know that if you don't pick up the signs and symptoms of childhood trauma, depression, anxiety early, it leads to poor educational performance. It leads to higher rates of drug abuse. It is an extraordinarily problematic thing. Similarly, so we are doubling down in that area to really start with early childhood education, children's mental health. We'll be starting many projects related to children's mental health very soon. There are more than 100 all over the world networks in children's mental health, but it's such a central issue. The suicide rate for children in New Mexico is so high. In the United States, so many children commit suicide, teenagers. So those are some of the problems I want to work on. We are in this year going to start several new childhood mental health echoes in New Mexico to try and deal with this issue. It's a big problem. It's one of many, many big problems. But I think that, if your mental status is not good, that you're not feeling the joy of life and you're not at peace, it will impact every other aspect of your life.
Yeah. And I think one of the things with mental health is, and I think one of the issues of it, especially in New Mexico, is the stigma around it.
Yes.
And I think a lot of schools and institutions really struggle with that because we don't fully accept getting treatment and we don't really fully accept getting help as a society. Does Project Echo, do you think it's contributed in any way to eliminating the stigma around some of these issues?
It's a very interesting project. I don't know if we have any specific projects, but it is definitely it leaves scope for someone else to come and actually start projects in those areas because it is so critical. One of the things that happens often in a society that is so financially driven, right, is that we forget some of these things. That if there is stigma, even if I'm suffering, I would rather suffer, but not out myself. And I think that this is why societal change is hard. Knowledge is a part of it, but it has to be adapted to the culture. And you talked about a cultural issue here. When I go to different countries in the world, I find stigma for mental health disorders is very different in each country. In some places, it's huge, in some places, it's little. And so this is where all teach, all learn comes into play. This is not a psychiatrist's job. They don't know how to do it. But when you build a community of families and learners and community health workers and teachers, that's when you start creating new solutions. So the deployment of ECHO is not a knowledge dissemination mechanism alone. It does that as step one. It is a way to create new solutions, new ways of doing things, which are more appropriate. They are hyper local because they're meeting the needs of those individuals in their circumstances close to their home in ways that they are willing to accept. So that is really the principle of ECHO. It hasn't been used effective that much in reducing stigma, but it should. In HIV, we have done a lot of that across the world because in HIV, stigma is a very big deal. And many people would rather die than tell people that they have HIV. And so all across Africa, even in the United States, there's a lot of work in that area.
I want to go ahead and finish off. I asked this question during most of my podcasts at the end, but what advice would you give to people who have ideas for creating change in their community but don't know where to start?
I think there are certain qualities that are required if you want to make a big change in the world, right?
Mm-hmm.
These are generic qualities. And all big change in the world starts with your own community. It doesn't start with the whole world. I started with my patient, right? It started in New Mexico. But you need to, first of all, have the courage to believe that you can do it. That failure also has stigma, just like mental health has stigma. That you're not afraid of failure. You are so attached to your mission to change the world or change your community that you have the courage to accept and say, if I fail, I fail, but I am going to dive into this water. The second important thing that you've got to have, if you want to do something big, and if you just want to change your local community, that's fine. But if you're going into your local community to ultimately affect the whole world, then you want to try and solve a big problem.
Mm-hmm.
That means something that is huge. I mean, you articulated one. The mental health of children would be an example of that. So think of big problems that the world has, and then try and solve them in your community. The third aspect of it is perseverance. Essentially steadfastness. That is not giving up, because many failures occur. Lots and lots of people come and tell you, this is not a worthwhile activity. You should instead be spending all your time making money or whatever be that, or this can't work. One of the common things people tell you, if this could have been done, it would have already been done before, right? And so you have to be steadfast in your belief that you're going to make a difference and accept failure. Accept failure as a way to step back, learn, and redesign. So it is not as if the final solutions get created in the very first round of innovation. Because one of the important aspects of innovation is like a marriage. It's like a dance between two people. That means there's an innovator who comes up with the ideas, but the dance partner are the people who have to adopt those ideas, who have to accept those ideas. So innovation is not just an exercise in intelligence and good ideas. It's an exercise in emotional intelligence. It's an exercise in listening. It's an exercise in learning. It's an exercise in humility. What makes this whole thing succeed is relentless belief that you're going to succeed eventually, and having the courage to just not giving up. That is critical. When you do that and then start in your community, then you create solutions that can ultimately change the world.
Thank you so much for listening to the Lifter podcast with Project Echo. Stay safe, and we'll see you next time.